Are we recorded?
We're in the cloud. Yep.
Okay. Well, this is the meeting, August 2024 meeting of the Nantucket Board of Health. The meeting is being audio and visually recorded. And we start, I think, usually by asking if there are any public comments.
Sorry, first you do a roll call first.
Oh, all right. Well, who is present? Ann Smith, Vice Chair.
Mary Lepre.
Jim Cooper.
Harry McKenna by Zoom.
Rocky Marmontes by Zoom.
Hi, welcome.
Thank you so much.
So now I ask if there are any public comments, right? Anyone would like to, who is attending this meeting that would like to comment publicly, we would like to hear it if you would. Hearing none, we will go on to approval of the minutes. Very complete minutes, I thought. Does anyone have any questions, comments, changes, anything they'd like to?
I have no questions. I'll make a motion to accept them.
Second.
All in favor?
Aye.
Aye.
You gotta do a roll call because of Zoom.
All right.
Yeah, because of I'm participating by Zoom, we gotta do a roll call vote.
Carrie,
Aye.
Meredith,
Aye.
Jim,
Aye.
the vice chair says aye. So the minutes are approved. Now, number 4 on the agenda is the public hearing, which, as I recall, is still open.
Correct.
From our last meeting. We were talking about changes having to do with the Nantucket Harbor watershed in relation to Article 4 tight tank policy.
So. Yeah, unfortunately, I was away last week and I've been trying to catch up with town council on some of the changes. That I added in a little bit here. I know that, you know, the big part of the discussion last month was the whole, you know, kind of the problem of new construction when you have a tight tank and, you know, at the same time trying to protect the environment in this area and get everyone on the tight tank at the same time. So I've been emailing back and forth with DEP and, by the definition in Title V, now mind you, we have an open definition for new construction. But by Title V, new construction technically is allowed on a tight tank. As long as it's not an increase in flood. So you couldn't add another bedroom on every other tight tank. You might be able to add, for instance, like let's say you're adding a sitting room or you're popping out a living room to some degree. We would be able to do that as long as you're not increasing the design flow of the system. And now that doesn't necessarily mean just solely a bedroom. There's a bedroom count, which is involved with all floor plans and designs of houses. It's the cumulative number of rooms and like the divide by 2 and round down. Locally, we define new construction as any increase in square footage. So any addition where you're having to be cause for an upgrade. So I'd really like to kind of run that new construction stuff through town council first to see if that's you know, something they agree with, because when I spoke with town council last month, we had both agreed not to change the definition in this regulation of new construction. It's gonna kind of alter it to go use the Title V definition instead of our local one. And people sit around, I don't know if that's a good idea, because it's a little confusing with all the other regulations. So I'm thinking if we added a section, letter D under requirements. You know, we could add something in there to the effect that new construction would be allowed on a tight tank if there's no increase in the actual design flow of the system. And that the, proposed construction complies with that of the structure. So
I got a couple of questions. So anything that's in there right now is good. Any kind of system that's in there right now is good. Nothing has to change.
yeah, so you wouldn't be automatically forced up.
All right, so let's say someone buys a piece of land in there and they put in a 10-bedroom tight tank.
Well, you can,
That would be some type.
yeah, you couldn't do that.
Why?
Well, if you're regulated to 1 bedroom for that 10,000 square feet.
All right, so what you're saying is guy buys that piece of land, puts in a 2-bedroom, or say a 3-bedroom house.
Yeah.
He just, the tight tank has to be sized for the 3-bedroom house. And then he's limited, he can't do anything else.
So what happens with that is you can't do any of that type of construction on a tight tank. So I think there's only maybe 2, maybe a few more vacant lots in that area that are 10,000 square feet, which, they need to be 10,000 square feet or more per bedroom. So for 10,000 square foot lot, you get a 1-bedroom house. Now, I added in there a special variance, which would allow the board, to allow for a variance from any part of the regulation. And I think it's up to the board to consider, one of these vacant lots that they install an IA now. They might be able to build a 1-bedroom house. And then in the future, when the system fails, they would be required to install a tight.
Well, I got a whole bunch of things through here, and the problem I have is it seems like we eliminate people to whatever they have now, and they have no access to extend.
Well, any property's gonna. Whatever any property was approved for in the past,
That's all you get.
that's all you get. That's all you ever get. So depending on your lot size, I mean, if you have a 3-bedroom system on an acre lot, well, you could expand the pool.
Now, what about the two IA systems we just gave last few months? What about those people? What do they do?
So they can build because it's an IA system.
So they can add on.
Correct.
I thought,
Yeah.
did we not put a stipulation in there?
I don't think so, no. So I think kind of to juggle and come to a resolve on both those things, it'd be. I know at least one or two, like I said, vacant lots that are 10,000 square feet, which by Title V and everywhere else on the island and the state makes it. It's conforms to Title V and I think I would want to. So as long as you can fit it well and sort of resources. So I think since there's a limited number of actual vacant lots, the board might consider granting these folks, the ability to install an IA to allow for the building of a 1-bedroom house. And then in the future, once the system finally fails, they'd be forced to install it.
So this right here says that For the purpose of septic system design, single-family dwellings shall be presumed to have at least 3 bedrooms. So
Yeah,
you're gonna be able to get any type tank you put in there. Smallest one.
Where are you, Jim?
Gonna have to take care of 3 bedrooms.
no, I mean, it's still built, the capacity is still built on, the square footage or the number of bedrooms, which.
So then we can't keep this in it.
Well, I mean, that's part of Title V anyways, that they're all presumed, that's on new construction, so. Some of this isn't gonna directly apply to this regulation, it's,
Aren't there only 2 or 3 open lots?
that's what
They are about 10,000 square feet,
I
so
believe
they could only put a 1-bedroom house on that if somebody wanted to.
correct, and when you do that, you restrict the property to a lot. So like everybody, yeah, Jim, so they're all presumed to so if you had a vacant lot. And it's an acre, every system's presumed to be 3 bedrooms, but, you know. That would be kind of a.
Let me ask you
size, but,
How many year-round people live in it now? Are they all mostly summer?
I think for the most part, it's mainly seasonal. Gary, I know how this can go.
Yeah, we get back.
Gary?
Yes. I guess one of the things is that, we've approved stuff because based on the old regulation, but this is a new regulation going forward. So, from this point on, stuff we did in the past may not have been allowed, in the past, but, was because of the wording. One of the questions I had was, we mentioned in last month's meeting about the transfer property out on Smith's Point. And there's really no mention in the regulation about transfer, whether a tight tank is required at a point of transfer, or I remember the discussion was about that, but there's no mention in this in this modified regulation about does a transfer trigger something?
I thought I saw something in here. If it transfers, you have to go to a. Maybe I'm wrong. I thought I saw something in here that says if you transfer, maybe not.
Yeah, I know in in the minutes from last month's meeting that we talked about transfer. So I mean that's what brought the question up, because I went back to the new regulation and I didn't see any mention of, does a transfer trigger up where I live, if I were to transfer my house, we're in technical failure. I would have to, upon transfer, have a new septic system installed. So there's no mention about what transfer, if a property transfer triggers anything. Yet we talked about it last month. So I'm just.
So the way this goes now, if you transfer a property and the property has an IA system, can you leave it the way it is?
Yes, that part was kind of crossed out from, based on the discussion last month. But that's up to the board to discuss, so that's, something you feel like you want to incorporate. Originally, I had incorporated that as that's in line, as you know, Carrie. And the board, that's in line with the whole Nantucket part of the watershed.
Yeah.
The rest of the Nantucket part of the watershed is installing that an IA on a property transfer. In this case, it'd be a type.
It'd be switching over to a tight tank if the system is in technical failure or hydraulic failure.
Right, correct.
Transfer. Okay, so essentially the same rules apply. It's just that the response would not be an IA system; it would be a tight tank.
Yeah.
Okay.
Yeah, that's the feeling of the board.
I mean, is that stated in Title V, or is that something that this regulation should mention?
That's something this regulation should mention, and that's, that would mirror the rest of the Nantucket Harbor watershed regulation.
Okay.
So if we get this changed the way you want it. It says here, the Board of Health in its sole discretion may issue a variance, but if we get this the way you're gonna change it, there's no room for a variance for anybody.
I think more of the variance would be to allow one of those vacant lots to be able to build a one-bedroom house, allowing them to install an IEA system to build a one-bedroom house.
I would,
If that's what the board wants to consider.
but if we're trying to get have everyone over there be tight snake, then why would we allow them to put an IA in that?
So the problem is.
Or we would, it would be at our discretion if they can put an IA in versus. Or just say everyone needs a tight tank, but there's the flexibility that somebody could put an IA.
Right, correct. And there's no new construction. By Title V, there's no new construction. So, that came up, I think, 2 months ago or something with property and, they were adding 2 bedrooms, but so, the trade-off for the bed and the height, but Title V, it doesn't allow it.
So if you have 10,000 square foot lot, okay, you're only allowed one bedroom, right? On 10,000.
Correct.
So what you wouldn't have, an IA system wouldn't get you any miles with the separation. You're only allowed one bedroom. Why would you want an IA?
Essentially to comply with Title V, which you need to do.
But if what we're trying to do is end up with everyone in the end result having a tight tank.
Right.
Why isn't that, you're saying, look, you've got 10,000 square feet, you can have only one bedroom. So if you're gonna have one bedroom, why don't you just have a tight tank? And you're getting rid of an eye.
Right. No, the goal is to get everyone on the tight. It's, the problem is this Title V doesn't allow for that. So.
Title V doesn't know what.
New construction on the tight. So you can't build a new house
Using a tight tank.
using it.
I'd like to suggest something. I think we're going all over the place here and we've got amendments or new things throughout this whole thing.
Right.
It doesn't make sense to go one thing at a time and approve that one or not approve it and then go on to the next. I feel like I'm okay. Jim's saying one thing and then this says something and I think we need to go in some sort of a coherent order. That's what I'd like to do. But first, I wanted to ask you when you said, I think it needs to be looked at by the town council, town, attorney.
Yeah.
Are we ready to do that? Or should we postpone, have the attorney look at these changes and then take them one at a time?
We can, yeah.
I don't know what everybody thinks is
I
the
don't
best thing
think
to
you should
do.
rush into this like today and make it, I really don't, because I think the last 2 months we've given permission to 2 separate people to have IA tanks over there and to expand their buildings and move one building
Right.
and move the IA system. And the last month we just gave it to someone else and allowed him to have a brand new IA system.
Right. Yes.
So, I mean, if all of a sudden we just shut that down, then I don't know, it just seems. I don't know. I still have a few questions, but I think you're right. I think we shouldn't, we should probably have the lawyer.
Well, if we approve it, say, oh yeah, that language is fine, and then the lawyer says, you can't say that.
Yeah.
Then we gotta start all over again, right?
Right?
I also wonder is this the right time to bring up the letter that you received, or is that a whole nother situation?
Yeah, you can bring that up.
So all of us, John forwarded to us a letter written by, I think, a homeowners association.
Yeah.
Was it
I'm not sure.
a group of homeowners? And as I understand that,
Just one owner.
It was one owner?
And they were saying that there are others in that same situation, but they weren't necessarily speaking for them as a group, as an organized group. That was just owners at 5 California Avenue.
Okay.
Yeah.
Well, their point, I think, was that all this has changed since they had believed that they were going to get town sewer.
Right.
And that project was turned down.
Yeah.
At town meeting, I think.
Right, yeah.
And so the point of this person is that since the whole idea of what was happening out there has changed, maybe this whole concept of whether there needed to only be tight tanks should also change. Am I stating that kind of correctly as you understood it?
Well, I think, yeah,
It sounded like he wanted us to reopen the idea of what this tight tank regulation should actually be in that area, and whether indeed we might be able to approve IA systems. That's how I read it.
right, yeah, I think, the regulations passed in 2015 and get based on the estuary study and the total maximum daily loads that were calculated for that area. And the way to improve that, the most effective way that is controllable is to limit nutrient loading from septic. So that was the basis for the fight.
I'm here.
Oh, hi, Malcolm.
Malcolm's joined at 4:23.
So
You, do you have a quorum?
We did.
Yeah, we do.
Okay, I just can't see everybody. Oh,
Carrie's
yeah,
on Zoom. Carrie's on Zoom.
okay.
Now we have you. We have everybody.
I have a question. If they're feeling like just that this area is being targeted, I mean, this could be something that could apply to any homes here within a certain distance of the harbor or water.
Yeah, I think part of the difference there is there's town water available to the other folks. There's no town water, so there's town.
Because-
Yeah, so it's.
But I think this is only gonna take care of villages, because eventually that is gonna get sewage. Because they were, and when they did the sewage 5, 6, or 7 years ago for Monomoy and everything, the people from Nantucket as a group get up and said, we will vote for this if you will guarantee us that we're next in line to get sewage.
Mhm.
And they said yes. So what happened is, next town meeting came, the people from Nantucket stood up and said, no, we don't want sewer. So eventually, they're gonna have to have sewer. So what we're talking about here is only gonna be limited, I'm sure, to Miller over the bridge from Millis.
Why are they eventually gonna have to have sewer? I thought there was a discussion because if Maddie can get sewer anywhere that sewer is unlimited bedrooms, and that was a big concern.
Yeah, some of us are looking into amending some of those regulations so that a development doesn't necessarily follow sewer. But that's a ways off, and that will require a great deal of discussion. I'm sure controversy as to whether or not it'll pass. But you're right. Sewer brings development. Now, at least based on the rules.
Okay. Yeah, I guess I see the tight tank regulations as really just being about Smith's Point. It is a unique area that can't get town water. Probably never will get sewer no matter what we do. And its location is, this may not be our purview per se, but it is in a very environmentally sensitive area. with the eelgrass and everything, so in Mattocket Harbor. And the other thing is that the drinking water, if that gets polluted out there, caused by septic, nitrogen loading
Mhm, mhm.
systems, they will have no town water. I mean, they will have no water at all. I see this as somewhat protecting their properties because at least these actions could minimize that happening, that they would lose the ability to have drinking water or any potable water. So I don't quite see, I mean, I know that the one letter felt that they were losing their property rights, but there's a lot more to lose if we don't do something to prevent the nitrogen loading from increasing. And it really is, it's a unique area. And I see this as not a slippery slide to do other things in other parts of the island, because no other part of the island has this kind of a environmental structure around it.
Right.
So, I really think it is just Smith's point. That the issue of John had mentioned there's probably only 2 lots that maybe could be built. And, we would have the authority to allow a 1-bedroom IA system because they can't do a new tight tank. And, the other thing would be that anyone buying anything on Smith's Point now, hopefully is being told that there might be restrictions that are there, that they're not buying it thinking, oh, I can do what I want. And then they're after the fact told, oh, these regulations prevent you from that. I mean, I hope that there's open and clear disclosure for anyone who's buying property there and knows that there are limitations, and, think before you buy. That's it.
So how would this affect a guy that has a regular septic system on there now, when he sells the property?
Well, that,
In Title V, it's fine, it's nothing wrong. We want to sell the property, will he have to abandon that for the pipe tank in?
that's up to the board, if you want to.
Well, it's not up to the board, if we put it in here, then it's in here.
Right. Yeah, if that's what you want to have.
So that would mean if we put that in there, that means that anybody over Millie's Bridge that sells a house that has Title V has to do away with it, has to put a tight tank in. Now does that go to the seller or the buyer?
It'd be the seller, the way, or unless it's put up in escrow, or the way that any other property that sells in Nantucket has to install it on the end.
So I think what we need to keep in mind, and I've said this before in other situations, of what we are and why we're here. We are protecting the health and safety of the citizens of Nantucket. We really should not be about real estate. We should not be about resale. We shouldn't be about any of that. We should be about whether, as Carrie alluded to, whether you'll be able to have water at all, whether you'll be able to have safe drinking water, whether the people will end up with some kind of, terrible diseases that you epidemiologists only know about, kind of thing. I mean, that's what our purpose is, I think, as the Board of Health. So we need to understand what is safe, not only for the citizens, but safe for the environment.
Right.
Beyond that, I don't think it's our job or our role.
And I agree with you, but if I'm sitting out over the bridge and I have a house and I've been there for 15 to 20 years and I have a Title V, and I'm pumping it out every 3 years and everything's fine, and I decide to sell my house, why should I be penalized? If there's nothing wrong, nothing wrong with my system. It's legal, I have it pumped out, I don't have a problem,
You're saying you have an old septic system.
I have a Title V septic system, which
Okay.
a lot of them over to do. And if they
But
pump
aren't we supposed to, wouldn't we say, okay, it's, you can leave it for now until it fails.
well,
At which
put it
time, if
right.
it fails, this is what has to
That's
happen.
Yes, but you can't automatically sell your house and penalize a person to put in a tight tank if he has a Title V and it's perfect and there's no problem with it at all. You should be able to sell it out to a buyer. And maybe when that's, like you said, when that system fails, then he doesn't have any choice except to go to a tight tank.
So, but this doesn't say that
No,
it says, replaced with a tight tank system upon hydraulic failure, technical failure, or any condition which the board will determine requires an upgrade, according to Title V. So it doesn't say if you sell your house.
No, but
have
we
to
talked
change it.
about putting that in here, that if you sell your house.
But we don't have to put that in
But
there.
what's
though.
selling your house have to do with the
I mean, that's,
system failing?
so we don't have to put that in there.
The only
It's gonna
reason
fail at a
talking
certain
about
point.
putting that in there is eventually getting everybody over the bridge to end up with tight tank.
But I don't understand the thing about selling the house. If your system fails, whether I own the house or Meredith owns the
That's
house,
true.
it's gonna have to be replaced with a tight tank.
Right.
And if Meredith
But
buys
it-
my
And
house,
I agree. but
she's
if
gonna
you-
know that when it fails,
But if you sell your house with a system that's already great and it's perfect, you shouldn't be penalized. You should be able to just sell it the way you'd sell any other house.
where does it say you
It
are?
doesn't say that you have to.
Well, then we talked about this in the beginning. That's what we talked about, to maybe put that in here
Right.
to force people into a tight tank.
Yeah, we talked, I brought it up because we brought it up at the last meeting. And as John mentioned earlier, one of the options is just that, the Title V, currently the Title V regulation would state that, upon sale of the house, the system has to be tested. And if it's in technical or hydraulic failure, it then has to be replaced, which is the Nantucket rule. I mean, that's the rule we live under in Nantucket already. So it would be applying that. But I brought it up because we talked about it at the last meeting in the minutes, and there was no mention of transfer. So I want to make sure that we know what we're talking about with this regulation. Does a property transfer trigger anything, or does a property transfer just trigger the existing Title V regulation, which is inspection? If it fails, you got to go tight tank.
Right.
Yeah, I mean, I think there should be a mention of transfer because that could be something that will happen, that a property is transferred. So there needs to be, and I think putting that thing in at the time, because there are a lot of things that have to happen when a house is sold.
Well, that's what it
Things
is
have to
right
be
now. If
tested.
you sell your house now, you have to have tight, if you have a septic system, you have to have it done.
You have to have it tested before you,
Before you
It
sell.
has to be
Okay.
inspected. Yeah,
okay, that seems perfect to me. Can we add that, John?
That the property transfer,
At the time of transfer, the existing system will be tested.
that's, I mean, yeah,
It
that's.
happens anyway.
That's,
That's the way it is
anyway.
already.
Yeah, that's.
Okay, so then what are we
so I
even,
think maybe some of the confusion is, so in the Madigan Harbor watershed area.
Yeah.
Yeah. Tennessee,
yeah, Arkansas,
Arkansas, all those areas is areas pretty clearly, and, is anytime, so the goal there is to get everyone on an IA system, nitrogen. Also based on, because of the nitrogen sensitivity of the area, so that regulation was developed. And in that is at the time of transfer, so if you have a conventional septic system in Nantucket, at the time of transfer, you're required to upgrade to an IA. If you pull a building permit for construction, so if you're doing an addition or anything like that, you're required to upgrade to an IA. Or if you're in technical failure or hydraulic failure, you're required to upgrade. So that's all spelled out in Connecticut Harbor watershed regulation. I think some of the confusion with this, when this regulation was first adopted by the board, I think it was more of a focus on failed systems. When the system had failed, that the property owner would be required to know. So, I think it's.
Well, I think that, all it has to say is that, upon transfer, if the system fails for any reason, technical or hydraulic, in whatever we call the specific section of
Yeah.
that the only solution then is to add a tight tank.
Right.
They can't put a different IA system in, and that's
Right.
really the only twist from the existing Nantucket rule would be
Right.
right.
they would have to do tight tank as opposed to when I'm in technical failure, I can put an IA system in.
right,
I have an IA system that's not working, I could put in a new IA system.
yeah,
Where we're telling now, if your system fails, upon transfer, if your system is any type of failure, you have to install a tight tank. I mean, that's just,
and that area that of interest, that area that we're talking about is carefully spelled out, so it's
Yeah.
very clear what area we're talking about, correct?
Yeah, so sorry, I don't think I included this packet, it would say figure 1 and it shows that area over.
you mentioned the figure, but I mean, it is a highly defined area.
Yes, exactly, exactly. I mean, to me, that makes it pretty clear what has to happen.
That simplifies it.
Yeah, okay.
Okay,
Now, do we have to designate that when it does fail and you turn to a tight tank, it can only be for the same amount of bedroom you have now?
Yeah, I mean, that's already regulated.
Okay, fine. All right.
So then all this red stuff here,
Yeah,
does this need to be looked at, or is it,
yeah, it should be looked at, right now.
Can we continue to?
so town council looks at it?
Yeah.
Let's you or your successor know what his or her feelings are on this,
Yeah,
and then we bring it back up again at the next meeting?
hopefully have a final draft that we voted on, or,
Okay,
if not,
which means the public hearing relative to this is still open.
right, yeah. It would remain open.
I guess I should ask if there's any comments from the public. Here,
Basically, then, if that's what we decide we're gonna do, then there will be no variances anyway. We won't need a variance.
good point, Jim.
Yeah, and so the variance section to me would be, the last meeting was brought up was the whole that you can't build, these vacant lots. You can't build on them because you're restricted to a tight tank. You can't build on a tight tank, so.
You were gonna change, put people one better.
Yeah, and the board would be able to grant a variance to install an IA system. And then, it's basically allowing these people to start from the beginning compared to some of these houses that have been there for 100 years. So. And eventually they'll all be moved on.
But what that final on the last page. 303-23, special variance, that's very broad.
Right.
Maybe it wouldn't be broad if we understood what 223 says. But it seems very broad now.
See, but that's the thing I don't like. If we've got this simplified, so
Yeah.
everyone's gonna go to tight tank. Why should we say that, the Board of Health and the suppression may give a variance from the strict application of these regulations according with. We shouldn't do that.
well, I think if I'm interrupted, I think legally we have to be able to issue variances.
Well, would the variance could they ask for in a variance?
I have no idea.
They couldn't ask for more bedrooms. And it wouldn't matter if they were too close to the border line, because it's a tight tank, it doesn't, you know what I mean? There's nothing they would be afraid of. They don't have to have 100 feet from the well to the tight tank, they have a tight tank right next to the well. Right?
How about if we ask
So
the council,
what would they need a variance for? Nothing.
how about if we ask the council whether we can get rid of 303.23? Just, because we have already said exactly what's gonna happen. The system fails, you put up a tight deck, simple as that. End of story.
So, yeah, I think. So what happened was, as the history goes back a couple of years, a a property was in technical failure, they were forced to install a tight tank. By the assistant health director at that time. And that's the one that just came back last month and was granted the variance to install the tank.
Right.
So, I mean, yeah, this language was. There was the whole questioning of the language, which shall instead of
Yeah,
may.
yeah.
Is that there? Yeah, it said, conditions under which a tight tank may be required, so that was crossed out to shall, so that was really hard.
We don't,
That if you had a failed
we don't
system,
give them an option. We don't give them an option.
Right.
If the system fails,
It fails.
you gotta have a tight tank.
I would say when you send it to the attorney.
Yeah.
Ask them to simplify this and make it as clear cut as is possible, that this is the rules. And that's it.
Yeah. I think though, we just have to, citizens have a right to ask for relief, so we have to have something about variances. And I don't know what it would ever be, but who knows,
Right.
So I like Ann's suggestion, let Alex sort it out.
Yeah, and then, all right, so my idea is that we have in the next, between now and September, we have the attorney look through this, explaining exactly what our purpose is,
And
that
see,
we want to make it pretty open and shut.
right, and see if we have the right to say, if your system fails, you have to have a tight tank.
Oh, we have the right.
Yeah.
We can say that. We have the right and power to do that.
I just
All right.
think this is a lot of gobbledygook. I don't mean that it's your gobbledygook, John, at
Yeah,
all.
no.
It's just,
Yeah,
it's a lot of gobbledygook, and if I were a potential new homeowner or something, I'd say, I don't know what this says. So let's make it so it's really clear.
okay. So
Okay,
You make a motion to continue the public hearing on this.
okay. You want to make that?
Second it.
All right, do I need a roll call?
You do, yep.
I'm sorry, Madam Chair, what are we voting on?
We're voting to continue the public hearing until next meeting in
Yes. Aye.
Meredith,
Aye.
and I. Carrie, you
Aye.
there?
Yes, I'm here.
Okay,
Aye.
good.
Okay.
Okay,
All right.
agenda item 5. A fee waiver for food establishment permit for the Center for Elder Affairs.
Yeah, so, they were looking to permit their kitchen. Now they just came in, this is down at the Saltwater Center. And, the normal fee for them would be $150, and, they asked for a waiver from that. I feel that I don't have the authority, the office, that's something.
I make a motion, we give them the waiver.
I second.
It's only $150.
All in favor, can we just say aye, or we need a roll call?
Yeah, you need
Need a
a
roll call.
and a second roll call.
It's
Okay.
Zoom, you have to do a roll call.
Oh, all right. Jim,
Yes.
and yes. Meredith,
Yes.
Carrie,
Yes.
Malcolm.
Yes.
Okay, so the senior center gets a waiver for the application permit.
So. We have our new directors on. Ron, would like to speak at all and introduce yourself. Spoke on the phone for about an hour yesterday, and it was great to catch up and get ready for him to start work hopefully in early September.
Good evening, everyone. It's a pleasure to get to speak to you. Some of you I've met before. And I really appreciated your input when I was considering the position. I am looking forward to joining the town, arriving in Nantucket and working closely with the board.
So
Great.
Welcome.
Welcome aboard.
it'll be his director's report next month. Um, but a few things that I have, obviously PFAS is still a hot topic, of course. And as of yesterday, Mass DEP, they've agreed to have a public information meeting on September 10th at 5 p.m., which is going to be virtual or all online as of now. So we'll be working on an agenda of the links for all that.
You'd say
5 p.m. Yeah, that's as of now, but they were.
and it's gonna be all virtual.
Yes, right, all virtual. The agenda for that will be posted on the calendar. So it's good they agreed to that. I'll meet them. We've been working with CDM Smith. That's our consultant who we work with PFAS a lot. And they sent us a draft version of an update to our webpage to include all a reorganization and kind of breaking things down by topics, homepage, more information on, health effects, drinking water, projects we've been working on around the town, or that have been going on around the town. So we're going to be reviewing that hopefully when we get out on websites. And we're also working on they had put out a one-page flyer kind of a quick information page, which I really like to update soon. And they're working on that as well. So it's always a balancing act of keeping the necessary information, trying to keep it, short and sweet, but obviously including all necessary information. Yes.
PFAS. So I guess one of my questions is, I know I've learned recently that some of these companies that we're using for consulting also work with the chemical companies. And so I'm wondering if any of this information that we're gonna give out to the public could be reviewed by like the PFAS action group of Nantucket or people or some scientists that work, because I think that it's a huge issue that we've been telling people if their drinking water is 20 parts per trillion or lower, that it's safe to drink, when we know that it's not. And I just would be concerned that companies that also consult with chemical companies are not necessarily going to have, they're going to be having the town's best interest, the chemical company's best interest, and that is not always, and maybe what is legal is not always what is safest. So I guess I would love to have an independent review to make sure that that information is, because I am finding that like some of these licensed site professionals say one thing and then we talk to scientists and they say something else. And I just want to, in everything that I personally have gone through with all of this, I want to make sure that we get the correct and safest information out to people. And saying that your water, if it's 20 parts per trillion or lower, that you can drink it is just not true and not safe. So is there a way to get sort of an independent review of someone that has no involvement with chemical companies to review this information to make sure we're giving people like the most accurate, up to date, safest?
Right. Well, I mean, I would go and we would go by what the EPA puts out, what NASA and the EPA puts out. Those are the guidelines for, those levels of those substances, and those have all changed, and SDEP updated those guidelines for private drinking water wells in May of this year, to reflect, the 4 part per from people, 4 parts from PFAS, 10 to generally, so. And still incorporating the PFAS 620 calculation. There is a whole new hazard index, score, which I think they have now calculation, but they put that online, that type of stuff. So,
But I mean, as a town, we could put, here are some other organizations, if you have questions like the PFAS Action Group. I know one of the doctor's offices is doing blood level checking, ordering the blood tests.
Yeah.
And so I guess I want people to have as much information, and it's great to say we've spent $15 million or whatever it is. But there's obviously more to do, and so giving people and articles and like as much information as possible. And then 4 parts per trillion, I think they say 0 level is safe, but they can only test down to 4 parts per trillion.
that
Is that
was-
correct?
I think
Okay, so, but it's not 0.
May I speak, Madam Chair?
Of course.
Just my comment on that. Yes, the action group certainly can review it, but I think and I said this at that Friday meeting, and I don't think you were thrilled about it, but as a organization, a governmental organization, we really have to depend upon certified organizations such as the EPA or DEP. And some of your consultants are very smart, but they may not always be correct. The beauty of science is there's controversy and debate. And I think they had a lot of good ideas. And obviously 0 is clearly what we should get, but it may not be possible. So I think this organization, if we publish something or give guidelines, it has to be based on the state or the federal guidelines. And the action group can comment on that. They have a public right to comment on anything.
Could we not put links to some of the researchers, or
Do we what?
could we not put links to organize other, and I'm not just saying the PFAS Action Group, I'm saying like any organization that's involved with that, about what, this is what the EPA says, which is not always the most up to date, and maybe here's if you want more information. Like, I guess I just want to make sure that we're giving people, because I think some of these consulting companies just don't always have all the correct information.
What I would suggest, and I don't hate to put this on Rocky, but when he comes on board, I'll talk to him about that, about what we should link. Because again, we are a government agency, and your consultants are very bright. But if I may be brash, sometimes they were a little arrogant at that meeting, like they were the only ones that knew what to do. And
They're not my consultants.
well, whoever consultants they were very bright, and I thought they were great. But sometimes they might be wrong, and I don't know if they are or not. So I think every consultant and every scientist has a right to express their opinion. So when we start to expressing opinions, then we have to be careful about what opinions we express. So when Rocky gets on board, after that's actually after the September meeting will be great. We can discuss about what I think the board and the health department should link. So thank you. Sorry, Rocky, nothing else. You got a lot to do.
Looking forward to it, Malcolm.
But this is important, because we have to, I think you understand what I'm saying. I mean, science by nature is controversial. So, and we just have to make sure that we publish things that are as close to reality as possible. And we never will.
Yes.
Well, it always has to be evidence-based. I mean, that is everything scientific, particularly everything medical. Evidence-based things do change over time. And so I think when we, whatever we publish has to be what the best current evidence is telling us.
This isn't going away, obviously.
Right.
So
No, it's not.
we'll be continuing.
And I look forward to December 10th. It should be a great meeting and I hope
No, December?
September.
September.
I'm
Yeah.
sorry.
Well, a little more continuing on,
I just want to go back to this thing you were talking about the citation and thing. Are there any, that little group that gets together and puts a letter out from Nantucket? Is there any reason why now the people from Nantucket are here with this?
public meeting, you know, like.
Because when we decide what we're gonna do, we do it, you know, it's gonna be held pay.
Well, it was publicly noticed, it was
Okay, I just wanted to make sure that we're all
paper.
where we're supposed to be.
Yeah.
Okay.
COVID, I wanted to bring up a little bit, just because there's been, a spike going around the whole US, for the most of the US from what I've seen. We've had a little bit of a spike in the wastewater. Actually, Nantucket is right now, so the past month, I should say, is one of the highest case rates for the state. Is it?
Yeah.
Well, that's it. Good night, Irene.
Putting everyone to sleep.
Someone better pay the bill.
Yeah. So, I personally, I was on vacation last week and it's every other week, right? My family all came down with it and, it's traveling in the airport and so, to me, it was just a good reminder I've always been a big believer in masks and, you're in big public areas like airports, and traveling on the ferry and everything. I encourage people to wear masks and try and make protection.
John, will
Yeah.
the town be doing any vaccination clinics again starting in the fall? Because there are vaccines available again. I had mine 2 weeks ago.
Yep, so I was getting to that. That's in the works right now, Paul. So we don't have a set date or when that's gonna happen, but Jericho is working on it.
Okay, thank you.
Yeah. Ticks, Jericho's also been working with the contact epidemiologist in Hamner, as well as Patrick Roden Reynolds, is his name. He's a public health biologist on the vineyard, and Jericho's trying to arrange to have it, and I believe with Dr. Leopard at Tick Summit in September. So I've been hoping that it's gonna be in August. But it's looking like September now, so I think that would be a really good summit based on talks with the animals, very educated and knowledgeable as well as Patrick, so we'll hopefully have something together for September. Dr. Leopard, we don't know. So the updates. One thing I think is staff doing inspections and everything, some pool inspections, we still had some problems with, some of the pools logging their testing, logging their chemicals 4 times a day. One pool had to be closed, for a few days because it was way over the limit for chlorine. And a few others received citations. So it's another reason for us, like to really revisit the pool attendant scenario at pools, obviously from a safety perspective, but also, in our experiences, the maintenance, taking care of the pool and everything is vastly better when there's an example compared to the ones that just sent out so something we want to take a look at. We did have a foodborne illness breakout actually from late June, from some oysters. It was 3 cases of Campylobacter. And those were found all be associated with one, harvest. So, that was interesting. And actually one of the cases came from chicken. We thought was cross-contaminated, contaminated oysters. Um,
How did they get reported to you?
The hospital, or they came in through Haven. We found the cases, reported to the state. Reported to us. I'd have to go back and see a few. I think the EPA proceeds. And then, that was investigated by DPH. Steve Rice is, usually the senior food, inspector. We deal with that, handles mostly shellfish and everything. So, he handled the investigation of the points. Hopefully, it's good that it's caught. We found out where the source was, and based on that, we have to remind the food establishment you're required to keep your shellfish tagged for 90 days. So it's vital that the establishments do that and trace things that happen. So, had a few hiccups with that past. So, let's see. Maybe as we go on to the winter, we'll be looking at the regulations that we're working on. Maybe some food regulations and local food regulations.
You're mumbling sound.
I'm sorry, I am mumbling.
I mean, you're not mumbling, but the sound is mumbling.
Oh, sorry. Can you hear us now?
Yes.
Okay, I think it was me mumbling. But obviously summer's winding down, so a busy summer as usual. So yeah, you said before, we're excited to have Rocky start early September and go on from there.
I remember that there were some things throughout this past year that we gave variances to and continued them until the fall of 24, at which time they needed to come back to us with proposals for how they were going to handle their problem. One of them was the Sankaty Catty camp.
Yep.
A bunch of the camps.
And some of them were the camps without the bathroom, hand washing, all those other provisions that that we said, okay, we'll let you open this year, but you're gonna have to. So I just wanted to make sure that we didn't let too much time go by and have it get to be March or something, and then
Right.
here we go again.
So is that something you'd like to discuss next month?
Well, I don't know what the right timing would be. Did we give them, I think we gave them a date they had to be ready by, and I don't know if it was September or October, but I remember it was
Yeah.
fall of 24.
Yeah.
We
Well,
discussed having a special meeting about the camp regulations where we'd get town council and the camp directors together and go through the regulations, because a lot of them are new and some are, in my opinion, quite unnecessary. So
That was the camp of the sailing camp, the surfing camps, all that. But the caddy camp was a whole nother story.
that was a whole other thing. And that was, thank you, Ann. We need to,
we probably should review our minutes from the last year and just see what things that we left hanging out there that, you got to come back to us. And we did talk about having a camp summit, really, to kind of have all the camps come together. It's like, these are the regulations, whether you agree with them or not, this is what is. And this is where this is where we can grant variances, and there's some places we can't.
right.
Yeah.
But yeah, just to kind of do that far enough in advance that they can make adjustments if they can. Because a lot of it has to do with regulations that have changed, and to a certain extent, being more fully staffed, we're able to go out and do more inspections and kind of see what's actually happening on the ground. So it's fair if we could have we talked about having a summit for that, and then Sankey is a whole separate thing. We said they had to
Yeah.
come in with a
So
plan.
we should go back and look at what we said for Sanctity.
Yeah.
Because they had to build buildings or something if
They had to come up with a whole plan and they were supposedly working on it. So I
Yeah.
think, I wonder if it would be okay to ask John to sort of review I guess the minutes or these continuations that we gave people over the last year. And see when we gave them to, so that you can hand it over to Rocky and say, yeah, this is.
Could we do this not at our September meeting, but at a meeting, like either a special camp meeting, maybe beginning of October, or I'm just thinking our next meeting is 2 days after the special town meeting, so
Yeah, I think it's.
Oh, gosh, yeah.
that's a.
Yeah, so with this,
All right, so yeah.
the special camp meeting, we can schedule independent of our regular meeting.
Yeah, that should
We
be.
have, I do, sorry, to make it Harry, I do know Heather wanted to wait until the camps were completed. So after September, she wanted to get all the camp together because she's the one reviewing. She was the one reviewing the policies and everything. So she wanted to do a special meeting with all the camp and their directors to sit there and say, hey, this is our policy. And this is what's going forward. But I know it's after September, she wanted to do that. She wanted all the camps to be able to attend. So to do that, make sure all the camps are closed. Come school year, they're closed, and then that's where the meetings can.
Right, okay. Okay, but I just feel like, I know the camps and I remember the Sanctity thing, but I wonder if there were a few other things out there that we said, okay, get back to us.
Yeah.
And I wondered if you could just take a peek at that.
Absolutely.
Yeah,
Well, I think October probably be a good time. But in September, we could, we'll keep that.
okay,
That's, yeah. Thank you.
well, thank you for jumping in and
Yeah, thank you, John.
being the acting head.
Thank you.
It's been great.
Terrific. Thank you.
Yeah,
Thank you
you have been.
very much. Very busy time, and thank you for working with all of you.
And thankfully, you're not going anywhere.
No,
They got leaving.
I'm still there.
You're not going in.
I'm not going anywhere. No, I'm still here.
You'll see me, still see me every Wednesday.
Yeah.
okay, are we ready to adjourn? Do I have a motion?
To adjourn.
So moved.
Second. All in favor?
All in favor?
Roll call.
Aye.
Roll call.
Roll
You have to
call.
do a roll
Tim.
call.
Aye.
Ann, yes. Meredith,
Yes.
Yes,
Carrie,
yes.
Malcolm,
Aye.
I think we're finished.
We're done.
Great,
Yeah.
thank you very much.
Okay, thank you. Thank you, John.
I'm into office to sign home.
Malcolm.
Yeah, I'll be getting.
Huh?
I'll email.
Okay.
Yeah.
That was the main concern.